Adele Dimple.
Uh,
Can you lay down for me? Hello, Adele. My name is Hunter Dimple with the Glendale WMSA. Do you need medical assistance today?
yes, my hip. Oh God.
Can you tell me when and how this instance occurred?
It happened about a month ago. Somebody tripped me on the treadmill, and it just keeps getting worse.
All right, and on a scale from 1 to 10, how would you rate your pain today?
Oh my God, it's 11.
I'm so sorry about that. And is it going to be your left hip or your right hip?
It's my left hip.
I'm so sorry about that. Okay, well, I'm going to go and get the doctor for you. Can I grab you a glass of water?
Yes, I wish it was a bottle of liquor at this point.
I understand, but unfortunately, we can't do that here. But I'll go get the doctor and I'll go get that glass of water for you.
Okay, thank you.
Hey, Dr. Illy, we have a patient. She was tripped on a treadmill. She claims that her pain is a 11. Um, it's on her left hip.
Okay, perfect. I'll be right in with her.
Okay, thank you.
Okay, Adele, my name is Dr. Illy. I'm here to help you. So I hear that you had a fall from a treadmill. Your pain score is 11 out of 10, and we're looking at your left hip.
Yes, ma'am.
All right, and I'm going to start by asking a couple of questions. Are you having any numbness or tingling at all?
No, it just feels like a stabbing knife in my hip.
All right, I'm sorry to hear that. Is your pain localized to just your hip, or is it radiating to any other part of your body or leg?
It's just my hip.
All right, so I'll have my assistant Hunter here take your vitals. I'll be sure to get you some pain meds as soon as I can get your updated vitals. Do you have any allergies I need to be aware of at all?
Not that I know of.
Okay, perfect. Try and hold still. I know you're in pain and uncomfortable. He'll be getting these done very quickly here.
All right, so it looks like her temperature is running 98.3. I'm going to go ahead and get her blood pressure. Her blood pressure is 128 over 83, and her pulse is 92 beats per minute.
All right, so your vitals are stable. I'll go ahead and prescribe you some pain medicine. You have your glass of water. Just go ahead and take that. All right, good. So now I'm going to begin a physical exam of your left hip. This could be a bit uncomfortable, so just let me know if you're feeling any pain. Try and take some deep breaths through it if so, and remain as still as possible, okay?
Oh God. Oh. Oh God, it hurts so bad.
Okay, I'm sorry that part is at least over with. It's looking like you do have some tenderness to palpation, edema and redness to your left hip. I think it's best we go ahead and proceed with an x-ray. Hunter, can you set up and start our radiology equipment? This part should be otherwise painless. You just do have to remain still. We will have to keep your legs straight and get an image of your hip. If anything tends to hurt, let me know and take some deep breaths through that.
Okay, the x ray machine is on.
Perfect. I'll go ahead and proceed with this x ray, ma'am.
Oh,
Okay.
God.
Oh, I'm sorry. Take some deep breaths in through your nose, out through your mouth. All right. So, what I'm seeing here is a clean transverse fracture through your hip bone. What this means is that it's a horizontal break straight through your bone. From the looks of it, I would recommend an internal fixation of your hip. What that means is I would just be inserting pins and screws to hold those two bones that are fractured together, and it will repair your hip so that you can heal. The outcome from the surgery is looking like a 6 to 8 week recovery period. How are you feeling about surgery and moving forward with that?
No, I guess, okay.
Okay, I know it can be scary. We can provide things if you're having a little bit of anxiety. There's something called Versed I can give you before the surgery, it can calm your nerves. You would also be put under so you'll be completely asleep. I'll make sure you have good pain medication so you don't feel a thing. But it's looking like surgery is definitely indicated if we want to get this hip fixed. All right, I know it can be a bit nerve wracking. But I will talk about, at least right now, what I'm expecting until surgery. It looks like I have an opening next Friday night. Until then, I would like for you to take oral pain medication every 6 hours. I'll prescribe you oxycodone. I would like you to be non weight bearing to this entire left leg. So I don't want you to touch down on your foot, bear any weight. I don't want you to walk as much. If you absolutely need to walk, I'm going to give you and send you home with some crutches. To the bathroom, things that are absolutely needed, but I do want minimal use of this leg completely until I see you next week. I don't want anything else to go wrong with this hip, given it's been a month and you've been walking around with a fracture.
Oh, no.
I know, honey, but you've done the rough part. You've walked around, like I said, for a month. But we're going to get you back up and back moving, back going, okay?
Yes, ma'am.
All right, Adele, here's your crutches. Do you need help using them?
No, I know how to use them.
All right, so I will have him go type and print your discharge paperwork. I know surgery is a little bit out, but I want to prepare you for what to expect afterwards, since I kind of told you the precautions I would like you to take beforehand. So, afterwards, like I said, it's a 6 to 8 week recovery period. I will send you home after surgery with oral painkillers and oral antibiotics to make sure that the incision site does not get infected. And we'll move from walking with crutches to walking with a rolling walker for 1 week. After that week, you're good to go to walk normally. I just want a little bit of help given the extent of the fracture. And I want you up and moving the day of surgery. It helps promote circulation and it helps promote healing. Staying in bed and not moving around too much actually can stiffen the area, and we don't want that at all. We want good healing, good circulation, and you up and moving is what we would like to see. So I'm going to go ahead and schedule you for Friday night next week. Do you have any questions for me before I let you go for the night?
No, ma'am.
Okay,
Thank
well,
you.
you're welcome. I'm going to quickly prescribe you some oxycodone to take home. 1 second.
Adele, do you have health insurance or are you going to be paying with a debit or credit card?
I have health insurance.
Okay. Okay, let me try to run this machine over here real quick. All right, here's your insurance card back, and here's your discharge papers.
Okay, thank you.
Do you need help getting back to your vehicle?
I think I can manage.
All right, well, you stay safe.